get everyone's attention, I think we're going to get started. Welcome to the 2019 CAPS presentations. We're so happy to have all of you here today to see our seniors who have been working so hard over the past few months to celebrate their accomplishments and see what they've done since about January. Today we have two amazing presenters during this block. First will be Michael Bickford, talking about his experiences at Marathon Physical Therapy, followed by Isabel Elgart, who's going to be talking about immersion experiences for language in secondary education. So without further ado, Michael Bickford.
All right, thank you. All right, good morning, everyone. As Ms. Garrity just said, for those who don't know me, my name is Michael Bickford, and for my capstone, for my capstone project, I worked at Marathon Physical Therapy. Now, before I talk about my experiences there, I first want to talk a little bit about why I decided to do my internship at a physical therapy clinic. You see, I'm a very competitive fencer. I've been fencing since 6th grade. I've fenced all over the nation in tournaments ranging from very tiny 15-people tournaments all the way up to the Junior Olympics. So last summer, our story begins last summer during the Fencing Summer Nationals in St. Louis, where I ended up actually injuring my back so poorly that I had to be pulled from the tournament. Basically what happened was my core was so unstable at the time that my back had to make up for what my core could not, and I ended up pulling it. This was demoralizing for me, as I was doing extremely well in this tournament. I was in the top 32 of a 300-plus people tournament. So it was overall not a very good day. However, the day wasn't all terrible, as the injury was what introduced me to the world of athletic medicine. The doctors that I met that day and the medics gave me really what brought that whole experience around. And it was on that day that I actually decided that I wanted to become a doctor of athletic medicine in order to help people the same way that they were helping me. So I started looking around for internship opportunities at a hospital when senior year came around, as I already knew I wanted to do capstone at that point. But the problem is, not many hospitals want high schoolers running around their buildings. So out of the 5 hospitals that I reached out to, 2 said they weren't interested and 3 never returned my calls. So that was definitely very frustrating. But I never gave up, and I actually decided to reach out to Marathon Physical Therapy. Marathon had been where I went when I injured myself, so it seemed like almost fate that I would end up interning there. Now, even though it wasn't exactly what I wanted to do, the opportunity to see the other side of PT was an amazing experience, to be honest. Being able to learn about different conditions before I went off to med school and just getting the chance to learn how to talk to patients is going to be invaluable to me in the coming years. Now, let's talk about a few misconceptions about physical therapy. For a long time, I and many of my friends believed that physical therapy was just for athletes. But this couldn't be further from the truth. It turns out that physical therapy can be for anyone. And I actually noticed during my internship a trend of how different people came in at different times. For example, if you're in your 60s or above, many of these people came in the mornings to early afternoons. If people were in their 40s and still working or middle-aged, they would come in either between 11 or 1 as part of their lunch breaks. And after school, of course, we had our student athletes, moms, and even a few small children who had broken bones. So really, many different types of people come to physical therapy for many different reasons. Of course, we have our athletes who are there to heal an injury, but we also have many elderly people who are just trying to strengthen themselves in order to live better lives, and everyday people who are just trying to improve themselves, or who have aches and pains that they're trying to get rid of. Now, the way that we help people, we have many different ways of helping people. I mean, look at these things. What other profession do you get to use brass knuckles and knife-looking things in order to help people? In all seriousness, though, these are what are called fibroblasters. They're basically used to help heal the muscles. So when you work out muscles, they break and then reconnect. That's how they get stronger. That's just basic biology. However, if there isn't enough time given in between rests between exercises, they don't heal properly and can end up, instead of looking like this, to look like this. That's how people get muscle knots and just general tightness. So what these are used for is they put pressure on these different muscles in order to have them relax so that they come back to normal properly. But that's not the only tool I got to see during my internship. Does anyone know what this is? Raise your hands if anyone knows. So a few people kind of know. Well, if you were thinking that's a defibrillator, that's what I was thinking the first time I saw it. But it turns out that this is an electronic stimulator machine. Basically what it does is it sends electric shocks to different muscles in order to stimulate them if they are too weak to fire on their own properly. So during my internship, I did a lot of shadowing of Michaela and got to see all of these tools and many others in practice. But in my spare time, in between patients, I did a lot of reading. I would actually say I did a pretty decent amount of reading. So why is it? So actually, while I was writing this speech, I thought of a commercial that that connects to how much reading I did.
Here in my garage, just bought this new Lamborghini here. Fun to drive up here in the Hollywood Hills. But you know what I like a lot more than materialistic things? Knowledge. In fact, I'm a lot more proud of these 7 new bookshelves that I had to get installed to hold 2,000 new books that I bought.
Knowledge, huh? So why is it that I want to show you guys this video? And why is it that out of all the experiences, all the people, and all the tools that I got to see, that I want to talk to you about what I read? Well, one story in particular makes this point out, because I would say that the reading I did was just as, if not slightly more important than the patients I met. So one day, me and Michaela, the physical therapist I was working with, were having an examination. An examination is the first meeting with a patient where we sit down with them, talk about their injuries, the medical history, and basically try to decide what the best possible treatment is for them. The person that came in had back pain. This was something very standard for someone of his age. Basically, he just had it from overexerting himself trying to pick something too heavy up. But that wasn't the interesting part of the case. It turns out that he also had what he described as room-spinning dizziness, which made him very fuzzy and difficult to talk to during our examination. But the interesting thing about that is room-spinning dizziness is something often described as a telltale sign of vertigo. But when we tested him for vertigo, he came out negative. He actually ended up having to go see a specialist, and even they didn't exactly know what he had. This left the therapists at Marathon very perplexed. And the greatest part about this experience was I was perplexed right along with them. You see, after we had our first examination, Michaela printed out multiple different articles about all the different symptoms that this person could have had. So I was right there with them talking about how to treat this person. And that was an amazing feeling. Imagine being out of your depth for so many weeks, just trying to understand what people around you are saying, to suddenly being part of a conversation on patients. It was an incredible feeling, and it was because of the reading that I did that I was able to have this opportunity. See, that's actually something I noticed a lot in my internship, is that everyone around me is constantly learning, just like me. Now, of course, they're not learning new things every day like I was, and everyone there was extremely knowledgeable about the patients that we had. But what they were learning were different techniques in order to help slightly improve or slightly change how patients were getting treatment. For example, dry needling. Dry needling is something that a few therapists at Marathon are certified for. It's basically where you use acupuncture needles and send electric shocks through the needles in order to stimulate the muscles, basically resetting them. Sounds fun, I know. I actually remember I heard a story of a past intern who failed to tell the therapist she was working with that she was afraid of needles, and actually fainted in the therapy room. But that's what I love about this field. Not the woman fainting, but the fact that you're always learning. That's what I love about this field. It never gets dull, because every therapist is always trying to improve their care. I remember when I was first giving this presentation in class to practice, Mr. Vinnigan was telling me about his mother-in-law, who is a much more specialized physical therapist. And because of that, her cases are more difficult, and because of that, she has to go to conventions almost on a monthly basis in order to keep up with the medical field. And that's what I want all of you to take away from this speech: constant learning. You see, I never stopped learning during my internship, and really, I'm not even done. There are still articles in that pile of papers that I haven't read yet. And if you want to hear more about my experiences with that, you can check out my website with that QR code, or just on the CAPS website. But that's what I want all of you to take from this internship, excuse me, But that's what I want you all to take away from this internship, is the inspiration to look something up and learn about it. It doesn't have to be about the medical fields. It can be about whatever you want. Just taking the time to sit down and actually read something. Now, I know this can be difficult. I'm no better. There were multiple times I caught myself falling asleep while reading those articles. But with all the information we are exposed to nowadays, it's no wonder that the average attention span of a teenager is 8 seconds. Now, but isn't that all the more reason why we should be reading, to try to expand that? Because if we can find a love of learning in something that we're inspired about, it will make college and life so much easier. And speaking of college, what comes next for me? Well, next year I will be attending Drew University, and I was actually recruited there to fence. So I'm very much excited to continue my fencing journey, as well as dive further into the medical field to one day become a doctor of athletic medicine. Thank you.